Yeah, good morning, everyone. Today, I want to tell a topic related to which I experienced when I am in the Form D fourth year and when I am in the ward rounds. At that time, a case came in front of me. It was new to me because never I have been seeing that case. Uh, I will tell the symptoms, pathophysiology, diagnosis, and everything related to that case. But first of all, through the symptoms only, we have to identify what is the case, either it is dangerous or it may be okay, normally safe. Okay, a 40 years old farmer, he is a farmer, came to AMC, Acute Medical Care Department. Okay, he's a farmer, he was harvesting crops. He was harvesting the crops and accidentally what happened, don't know, the crops get infected by insects. So he was spraying some chemicals or insecticides or pesticides to kill the insects or to kill the worms that which are infecting the crops. So accidentally what happened means he doesn't wear any gloves or safety precautions. Accidentally, it was fallen on the skin, and through the skin or through the small tiny particles of the chemicals, we don't know because he doesn't have too much of guidance or idea on that. So accidentally, it was entered into his body. So he came to the hospital with the symptoms which I seen by naked eye. What are the symptoms? Number one, secretions. Number two, lacrimination. Number three, salivation. Number four, abdominal cramps. Number five, uh, vomiting. Number six, bradycardia. Number seven, pupil pupils getting constriction. Number eight, urination. So all these symptoms I have been seen but with my eyes. Secretions are there, lacrimation, salivation is there, abdominal cramps are there, vomiting is there, bradycardia, the heart rate is going. I will tell what are the vitals. People construct them. Okay, when I uh, when I put a torch, when I put a light on the pupils are getting constriction, not dilating. Okay, and urination, frequent urination is there. So, what are the vitals? BP was 150 by 90 mmHg and pulse rate was 50 bpm. Serious cardiovascular. Heart sounds I have here as well as to lump and dump. Okay. So everything going on like this. So I don't know. So everything going like this. The patient can't tell the details. So patient attendants are telling that he has harvesting the crops, but due to the insecticides infection to the crops, he has spraying some chemicals to kill that. So finally, he doesn't take the precautions, and finally it entered the body. So these are the symptoms. This is the past history and history of illness. This is a history of illness from where the patient has been getting infected. It may be a 1 hour or 40 minutes. I think so. It is around the 40 minutes because the hospital is little far from the his harvesting region. Okay, so my confirmation I don't know, but their emergency doctors are there, my mentors, and my associate professor is there. They are discussing like poison. Either it is a OP poison, either it is an insecticidal poison, or maybe it is a poison. It is a query. provisional diagnosis, it is a poison, but we don't know what is a poison because they they didn't take and come the bottle, what he has been sprayed, what he has been used to kill the insects like a weapon. So we don't know. So what is this poison? Generally, in the insecticides, killing of insecticides or pesticides, generally chemicals are used. These chemicals are called as malathin, paraffin, and diagenum. So these are the chemicals that which used to kill the insecticides. So these insecticides, these chemicals are accidentally entered into human body. So we will see some symptoms and we will see some scenario what happening. Okay. And finally, wait a second. So everything is going like this. Okay. So I have been symptoms. I have explained the symptoms like vomiting, several abdominal pain, secretions, lacrimations, salivation, everything is going on like this. Okay. So we are not confirmed it is a OP poisoning, but we are having an idea. Provisional diagnosis, we have an idea that it may be OP poisoning. Okay. So this what happening in OP poisoning means acetylcholine, anticholinesterase enzyme. It is generally it was inactive in the form, inactive. When we take the poison, this acetylcholine will get activated and it will be irreversible and it leads to toxicity. So when the compound has been taken into the body, it may be OP poisoning, it may be unknown. This acetylcholine levels will activate it. So this acetylcholine is irreversibly activated and it may lead to toxicity. So this acetylcholine acts on in our body two receptors. Number one, muscarinic. Number two, nicotinic receptors. So muscarinic receptors, when this acts, what happens, and nicotinic receptors act, what happens? Let's discuss. Acetylcholine. Acetylcholine. It acts on muscarinic receptors and nicotinic receptors. When this acetylcholine is acting on muscarinic receptors, you will see first symptom like diarrhea. Number two, urination. Number three, meiosis. Meiosis. M-Y-O-S-O. Number four, bronchial constriction and bradycardia. Heart rate will decrease. Number five, lacrimination. Number six, salivation. So, see, this acetylcholine is when in the normal healthy human being, it is inactive form. So when we take in the compound like malathins and parathins, this acetylcholine get activated and irreversibly activated, acts on muscarinic receptors, and we will see the symptoms diarrhea, urination, mysis, and bradycardia, bronchial constriction, and lacrimation and salivation. So I want to give a code for it. Okay, mysis means like pupil shrinking of pupil get shrink. Okay, so the code is dumble, DUMBEELS. Okay, D for diarrhea, U for urination, M for meiosis, B for bradycardia and bronchial constriction, E for emesis. vomiting. Okay, we call it vomiting. L for laxation, S for secretions for celebration. So up to here, everything normal. So this acetylcholine was act on. So this acetylcholine act on muscarinic receptors. You have seen symptoms called like dumbbell, DUMBELS, dumbbells. Okay. When this acts on nicotinic receptors, generally you will see a rapid desensitization, paralysis of skeletal muscles. So rapid desensitization and paralysis of skeletal muscles. Finally, nicotinic receptors. This acetylcholine acts on nicotinic receptors. You will see rapid desensitization, paralysis of skeletal muscles. Okay, so the case has been came and we have to see the symptoms. I have been seeing the symptoms and scenario. Everything is going on the well. So now so we have to identify or early diagnosis. It is a poison or not within the fraction seconds, like 5 seconds to 15 minutes. Everything is going on a way. Okay. So what happens next? I will tell. So we have to clean, remove the clothes of the patient and wash the skin, because if small tiny particles that which are present on the skin of a chemical or poison, it may lead to decontamination of skin. So rapid problem will be there. If not, if we not cured in the time, we have to clean the decontamination of the skin. So it is very dangerous. We have to clean everything. Okay. Number 2, gastric lavage. Gastric lavage, we have to introduce the Ryle's tube into the stomach. Gastric lavage, why gastric lavage is done means small quantity of the poison may lead to heavy or serious dangerous condition. So we have to clean everything through the vacuum, to the suction pump and everything. This light will be there. So when we introduce the Ryle's tube, through the Ryle's tube, suction will be done. All the secretions and whatever the poison or whatever the fluid that which are whatever the material that which is present in the stomach, it will be sent into this jug jars. Okay. So if I have passed to tell that nicotinic receptors act on acetylcholine act on nicotinic receptors. Number 1, rapid desensitization of paralysis muscles and skeletal muscles get damaged. So the patient may have the chance of gasping or coma. So maybe mechanical ventilation process may be present. Okay. So up to here, it's everything going on. So now the diagnosis or advice. Everything should be done like complete blood pressure report, complete urine examination, RFT, renal function test, LFT, and CRP, ECG, finally serum cholinesterase enzyme levels. The serum cholesterol levels, because this acetylcholine will affect all the organs, CBP, and we have to check the WBC count is increasing or decreasing because it is a unknown compound came from the outside of the body. And renal function test, how the creatinine and uric acid, urea levels are there. Lipid profile like AST, ALT, viral mark, AST, ALT, liver markers, liver enzyme should be monitored. And serum cholesterol is important because serum cholesterol is normally it will be there in 4,000 to 11,000. But in this condition, if the serum cholesterol levels are less than 4,000, less than 4,500, the absorption rate is more. The poison absorption rate is more. So it was dangerous. Starting, it will be very dangerous. Okay. So we have to see all these vitals, all these reports. Treatment. Is the treatment is going good or bad? What is the drug of choice? What is the drug of choice for OP poisoning or carbonate poisoning or bradycardia or heart block? Only one answer is atropine. Okay, atropine is the drug of choice for the OP poisoning, carbonate poisoning, bradycardia, heart blocks. Damn shit. Okay, so let's say the treatment is in a good manner or not. If it is in a good manner, what we will see the positive side effects. Okay, number one. So I want to discuss called atropinization. What is mean by atropinization? Means the drug of choice for OP poisoning is atropine only. Okay, so signs of atropinization number one. What I said, people get constricted when this poison has been taken. When we give the drug atropine, pupil size get dilated. Number two, heart rate increased, tachycardia. Number three, secretions, all secretions will be decreased. While symptoms, when patient came to the AMC, people get constricted, heart rate get decreased, secretions will be increased. So opposite, atropinization means the symptoms will be reverse. Okay. The drug of choice for OP poison is atropine only, not praladoxamine. The drug of choice for OP poison is atropine only, not paradoxamine. Okay. So when we see the signs and symptoms of atropinization, we will see like secretions are decreased and heart rate get increased and everything going in a good manner. Okay, the treatment is in a proper manner. The patient will be, I said, the patient will be safe side. So I want to discuss some anticholinergic drugs. What are anticholinergic drugs or cholinergic antagonists? There are two types. Nicotinic and muscarinic and nicotinic. Okay, muscarinic means all M1, M2, M3, M4, M5 blockers, receptors. Okay, this anti-muscarinic drugs, this blocks all M1, M2, M3, M4 receptors. Okay, muscarinic receptors are two types. Number one, non-selective muscarinic anticholinergic, selective muscarinic anticholinergic drugs. Okay, muscarinic selective anticholinergic are sorry, non-selective muscarinic anti-muscarinic are number one atropine, example, and scopolamide. Here also, selective muscarinic was pyrangianopine, darafin. Okay. anticholinergic drugs. The second type is nicotinic drugs. This is muscarinic, this is nicotinic. Nicotinic, these are two types. NN blockers, NM blockers. NN are ganglionic blockers. NM are neuromuscular blockers. Okay. So I want to discuss this atropine drug and its side effects. Atropine, it crosses blood-brain barrier. So you will see the effect called psychiatric effect. Patient may enter into the psychic condition. So here story what I tell dumbbells, DUMBLs. So it will decrease the diarrhea, urination, atropine, and pupil dilation and bradycardia, tachycardia. So this atropine is doing a good work. So few points related to atropine. Atropine blocks all M1, M2, M3, M4, M5, all atropine blocks all is muscarinic. So I tell that dumbbell, it will be reversed. It will be calm ho gaya. Silent, it will be silent. Okay. Atropine. So generally, atropine action on eyes or pupil. So on pupil there will be a alpha 1 adrenergic receptors. Okay, and M3 muscarinic receptors. This blocks M3 muscarinic receptors. So the pupil get dilated. Okay, pupil get dilated finally. So atropine action on salivary glands. How secretions are decreased means because atropine blocks atropine acts on sweat glands because atropine blocks M3 receptors that which are present in the sweat glands. So finally, you may see increased body temperature and fever may be appear to the patient. These are the good side effects. Okay, it was in the positive manner. Next, atropine acts on GIT. So here M1 receptors are there. Atropine block the M1 receptors, and you will see antispasm action. And production of HCl also decreased. Okay, and again, atropine acts on urinary bladder. So it blocks M3 receptors that which are present in the urinary bladder. You may experience that I have tell the urination, the urine gets stopped. So the urination is decreased. Okay. Next, atropine action on heart. Actually, at low doses, we will see bradycardia, but at high doses, we will see tachycardia initially. So what happens means, in heart, there is a SA node and AV node. So this atropine blocks M1 receptors that which are present on the SA node, and M2 receptors that which are present in the AV node. Okay, so this is the story. The some of the effects of the atropine on the particular organ like heart, and why we see the psychiatric effect means atropine crosses the blood-brain barrier, so it triggers the CNS. Atropine triggers the CNS, and finally you may experience psychotic effect. So this is a simple topic I want to tell normally. Okay, this is not a simple topic. It is a very dangerous. Okay. Thank you for watching my video. And I want to ask two few questions. Gastric lavage is contraindicated in number 1 OP, number 2 carbamate, number 3 hydrocarbons, number 4 paracetamol poisoning. So we have to answer in the comment box. And next, second question is antidote for OP poison is question. Okay, next. Atropine, if is overdose or atropine poison, what is the drug of choice? Question mark. Okay, next. So next, a case of 25 years. A male has taken some unknown compound, and we have seen some symptoms like secretions, salivations, lacrimations, urination, bradycardia. What will be the diagnosis? Okay. Thank you for watching the video. Thank you for watching everything. Yeah, if any doubts related, ask in the comment box and pin in the comment box. Thank you.